Hello everyone and welcome back to Style Optique TV. Now today is all about cataracts. Now most people have heard of a cataract. Most people know somebody with a cataract, but do you know exactly what a cataract is? Do you know what causes a cataract? Do you know the symptoms of a cataract? This is what I am going to share with you today. And if you stick around to the end, I'm also going to share some top tips on how you can prevent cataracts. My name is Eva Devey. I am an optometrist and eyewear stylist at Style Optique. Link is in the description. Okay, so in order to understand what a cataract is, we need to understand a little bit about the anatomy of the eye itself. So if you take a look at the diagram, at the front of the eye we have the cornea, and this acts like a window to the eye, and this is where light enters. And just behind the cornea is the coloured part of the eye called the iris. Behind the iris is the lens, which helps to focus light at the back of the eye, or the retina. The retina then picks up the light and sends it onto the brain, allowing us to see. So it is in the crystalline lens that is going to be our focus today. Now, when we are young, our lens is very flexible and very clear and allows us to focus on objects in the distance and also on objects close. So as time passes, the crystalline lens begins to lose its flexibility. It begins to harden and discolour and become opaque, and it becomes very, very difficult to look through. And this is what is known as a cataract. And there's a few different types of cataracts. The most common type is a nuclear cataract, and this forms in the centre of the crystalline lens and is the most common form of cataract with aging. The second type of cataract is cortical cataract, and these are like spokes that go in towards the centre of the lens, and when that spoke hits the centre of the lens, that's when it can impact the vision. And this type of cataract is most common in things like diabetes. The third type of cataract is called a posterior subcapsular cataract, and this forms on the back of the lens, and these very often can be quite tiny but can have quite a significant effect on the vision, and this type of cataract is also the fastest growing. Now, aging is the most common cause of cataract, but there are other causes. Cataracts can be congenital, which means some people are born with them. Cataracts can be metabolic, which is caused by too little or too much of the body's own natural chemical. You can have toxic cataracts, which are from certain medications. You can have nutritional cataracts, which is due to a lack of certain vitamins. You can have post-surgical cataract, which is as a result of another surgery on the eye. You can have a traumatic cataract, which occurs as a direct result of a trauma to the eye or a bang. And then you can have a secondary cataract, which is as a result of another systemic disease like diabetes. So as you can see, there are many, many things that can actually trigger or cause a cataract to form in your eye. So most people over 50 with a crystalline lens at some point are going to get a cataract. So what are some of the main symptoms of cataracts? Well, in most cases, cataracts do develop very, very slowly. In fact, they often develop so gradually that people are not really aware of any changes in their vision in those early stages. And they can often sort of blame the world for things rather than their eyes. For example, one of the common things we hear a lot are, print's not as clear as it used to be, or writing's much smaller than it used to be. But as cataracts start to progress, you can become very, very sensitive to light, and people often report seeing halos around lights, especially at night. So night driving and glare can become very, very difficult. There's also, as a cataract develops, there can also be a change in the vibrancy of colours. So everything looks a lot duller, and there becomes a reduced ability to see blue. And this is quite noticeable in the work of some artists, typically Monet. He used a lot of blues in his paintings, and as he developed cataract, he was more unable to see those tones of blue. So his images became duller and more kind of red tones as his cataracts progressed. And the other key symptom of cataracts, particularly in the later stages, are cloudy or blurry vision. In fact, people say it's almost looking through a really dirty or frosted window. So what is the treatment for cataract, and when should you consider treatment for cataracts? Well, if you have a cataract and it is beginning to affect your life in any way and reduce your ability to do certain daily activities, then is the time to think about having a cataract operation. Years ago, we used to wait until the cataract was mature or hypermature, or really quite bad until we operated. That is not the case today. Soon as you start having an impact on your lifestyle in any way, then we can put you forward for a cataract operation. And the great news is many recent advances in medicine have made cataract surgery one of the most safest and effective surgical procedures out there. Modern cataract surgery is hugely successful and has a huge impact on the quality of somebody's life. And the good news is it is a really minor surgical procedure today, and it takes approximately 30 minutes. The cataract in your eye, essentially your cloudy lens, is removed and a new intraocular lens is inserted in its place. And the other great benefit of cataract surgery is that when they replace your cataract lens with the new intraocular lens, it also makes you able to see clearly in the distance. So you may no longer require glasses for distance. You may only require them for reading and close work after your surgery. There's also been a really interesting study done recently that people who have cataract surgery, it actually reduces their risk of dementia over the next 10 years. We don't really know why this is, but it may be to do with the fact that that increase in sensory input from having that cataract operation is having some positive effects on the brain. So how can you prevent or slow down your progression of cataract? Well, one of the very best things that you can do is to wear sunglasses. UV can easily penetrate the cornea and penetrate the lens, and that can cause cataracts to come a lot earlier. It has been proven that people who work outdoors get cataracts far, far sooner than people who don't. So ensuring when you're out in the sun or when you're out and about that you do wear sunglasses, it can give you that layer of UV protection. The other thing to do is just to make sure you have a really good diet. There has been many studies to show that having a healthy diet full of antioxidants can also really help prevent cataracts. So I hope you found this video on cataracts useful. If you do have any more questions, please do ask in the comments below and I will make sure to answer them. Thank you so much for watching.